Hi, it's Dr. Noel Williams, Oklahoma City, Oklahoma, Optimal Health Associates, April 22nd, 2020. COVID-19 update. A couple interesting things to talk about. So a little more energy tonight, I think, than maybe last night. First, statistics, about 2.7 million people or so are infected, at least documented infected in the world. We're about 180,000 deaths. United States, we're about 840,000 maybe, and 47,000 deaths. There's been some revisions upwards of projected death rates again, but we'll talk about that briefly. And then in Oklahoma, we're approaching 3,000 and about 170 deaths. So kind of staying the course, going like this across the United States. Definitely on target to hit 60 to 65,000 deaths well before the projected date of August 1st. I think we're going to probably hit that in May, unfortunately, and it may go even higher. We'll just have to see. If we think about national news first, I want to talk about President Trump. He backed off some of his comments on slowing the reopening of the economy. He talked about, he contacted the governor of Georgia, Governor Kemp, who could actually give Governor Governor Stitt competition for incompetence. I'm done being nice, okay, because I know the Oklahoma Health Department is never going to care about anything I have to say ever after everything, and neither does the state. So, but Governor Kemp could be more incompetent than Governor Stitt, but that's a race. But he's decided to open all the tattoo parlors and all that stuff up right away, and Trump very wisely suggested that wasn't a good idea. But also in the news was Trump got rid of a guy named Rick Bright, Dr. Rick Bright. He's in charge of a part of the NIH, which is called BARDA, and it has to do with researching vaccines, meds, and everything. And he was kind of in charge of meds for COVID. And he says he got canned for political stuff, and he got moved to another part of NIH. I'm calling Rick Bright out right now. That's utter nonsense. Rick Bright made a decision with Plaquenil, which was a political decision to set it up to fail. So he's the one, if you had a COVID-19 diagnosis and you're at home and you're sick, but you're coughing and your doctor wants to call in COVID, he doesn't think there's any reason for that. And he restricted the use, which he can't restrict me from writing it, but he's restricted formally the use of Plaquenil to only hospitalized and seriously ill patients. The whole way Plaquenil works with COVID has to do with getting zinc into the cells and having that zinc, it's called a zinc ionophore, is the actual what that drug classification would be. And it gets the zinc into the cells, which then knocks out the COVID-19 virus. The hospitalized patients have gotten super inflamed. So it's not the virus anymore, it's the inflammation. And sure, the virus is contributing, but it's the inflammation. You have to stop the virus before you get that way. So the data that shows the Plaquenil is not as effective or may not be very effective in hospitalized patients makes sense. You have to use it earlier, but it has worked in hospitalized patients too. It's just the data is not showing that it's working very well. And it's also caused harm in hospitalized patients because the dosing protocol for hydroxychloroquine has not been followed. So if you give a lot more of a medicine that has toxicity than has ever been given, there's more toxicities. So he got moved from where he was at NIH. But remember, the NIH has failed us. These are the people, the only thing they've been raving about, oh, we're going to do a vaccine, we're going to do a vaccine, we're going to do a vaccine, we're going to do antibodies. All that's disappeared over the last 24 to 48 hours. You wait and watch over the next 7 days. See how much they keep on talking about vaccines, because like I mentioned last night, that paper came out with mutagenicity on the protein spike and 30 different strains out of 1,250 people in one area of China who were hospitalized. So it again illustrates that this whole vaccine rush and the Gates Foundation urge to do vaccines may not be the appropriate test, or not test, but the appropriate intervention. And it's going to get back to what I'm trying to get everyone to understand and what you need to tell all your friends. It's about nutrition. You can make your immune system better. You can take a strong multivitamin that has all the main elements in it like zinc and selenium and things like that. So what we call macronutrients or elements, along with your B's, your D's, D, and vitamin C. And that's an exciting point for everyone tonight. There's some data that shows vitamin C is very supportive to sick COVID patients at a high dose. So I've not been on the vitamin C bandwagon ever. I think it's fine to take it up to 1 gram a day, but I don't think there's this huge data set. So as a physician who's evidence-based, I can't recommend vitamin C as a novel intervention for viral diseases. But there's finally some good data that I can now say, yes, vitamin C has a role with COVID. And I've not been able to say that because there's not been data. Now, this is not the best data ever, but it came out of a hospital in New Jersey where they gave a bunch of patients, or a whole series of patients, IV vitamin C, along with all their other measures who were very sick, and another group of patients where they didn't give them the IV vitamin C. And they wanted this report out now because the patients have, with the IV vitamin C, got much better, faster, and they had lower morbidity and mortality. And so that, while not a double-blinded trial or anything like that, it is a great report. The physicians involved were very motivated and felt very strongly that it was an obvious change in patient condition. So we need to recognize now that vitamin C, probably 1 gram a day, is going to be very helpful. If you do get COVID, you may want to do 1 gram of 3 times a day. But I think that's some positive stuff. The data is not as strong as zinc. It's not as strong as vitamin D. There's more vitamin D data coming out. We want your levels to be over 60, and I always want them over 80 to 100. So the average dose for vitamin D is 5,000 units a day if you weigh under 130 to 40 pounds. If you're over 130 to 40 pounds, you probably want to do 5,000, 10,000 if you're up to about 180. And then if you're over 180 pounds, you probably want to do 10,000, and I'll put that on a post. But you need to be on vitamin D, you need to be on zinc, you need to be on a strong multivitamin. And that multivitamins have vitamin C in them. I don't necessarily think you have to add vitamin C, but it's certainly fine to. And then finally, you need to be on melatonin, because the melatonin stops the cascade of inflammation, which is why little kids don't get sick. So let's talk about little kids. Little kids don't get sick with this. They're so far as in doing all the research I can in trying to find bad outcomes. There's been one death of a infant in the United States so far. So it's very, very rare. And there's been one death of a 5-year-old and one death of a 17-year-old. There's scant numbers of children getting sick, and there's even scanter numbers of them dying. And the reason is, for the most part, they have very good normal immune systems. So when they get a cut, instead of it turning red like it does on me and then healing, it just heals. So they have just pro-healing inflammation, whereas us older people have inflammation, then healing. And so they don't go through those phases. So they're not ever going to be at as much risk. But if you were going to do some things to help them, it's all about just the basic vitamin therapy. So if you have a infant, get a infant liquid vitamin to add to either their, if they're really small, to the breast milk, or if you put it in a bottle, or to whatever they're using on a liquid form, or just if they're spoon feeding that awful stuff we all gave our kids when they were 12 months old before they were eating real food, put it in that. Then you can always do a daily liquid vitamin for them. That would be the number one thing to do. I really don't think real little people need zinc under 2 or 3. If you were going to give them some, you could give them 15 milligrams every other day. But they're really in very good shape. So just the multivitamin is going to be fine. You don't need to worry about the melatonin, because the whole reason they don't get inflamed is the melatonin that they already have. It's like amazing amounts. So they just need a multivitamin. Everybody else needs the whole kit and caboodle, especially if you're over 25, but especially 30. And so that's what I wanted to cover with vitamins. Now let's talk about exosomes for a second. Exosomes are something that I have a whole video presentation on. We use exosomes in my practice to correct inflammation. They're what are in stem cells. If you had a stem cell, inside of every stem cell, there'd be 1,500 bubbles, and those bubbles are exosomes, and they contain all these anti-inflammatory mediators and healing stuff. I'm going to talk more about that and do a separate post about exosomes and COVID. And so exosomes from a placenta are super awesome. Exosomes from stem cells are super awesome. exosomes from an inflamed lymphocyte that, let's say, has been infected by COVID, or if you have rheumatoid arthritis and you're inflamed, those exosomes can be inflammatory and icky. So different cells can secrete different types, but that's the cool thing about exosomes. There was a lady treated in New Jersey the last few days with an IV exosome therapy who was had COVID and pneumonia. Fixed her, just like the Chinese data. So we want to talk about that eventually. And then we also want to talk about my favorite. I'm just looking at my notes to make sure I don't miss anything. I think we're on to Oklahoma. And so Oklahoma is really interesting because Governor Stitt last week said we were going to start surgeries, and I have to look at the thing from the state health department because it's small letters and it's hard to read. So Governor Stitt last week said elective surgeries were going to open on the 24th. And elective doesn't mean, hey, plastic surgery. It means stuff like, oh, you're bleeding very heavily and you need to have what I would do all the time, a hysteroscopy D&C, where we look in the uterus and clean it out. Or you have rectal bleeding from colon cancer, or not colon cancer, but you have rectal bleeding that needs to be diagnosed. Or let's say you have terrible recurrent ear infections and you really need your tubes in your ears at this point. That's the kind of stuff that can be allowed. So that was all knocked out. It was all fine. And then today, out of the blue, the state made all these rules for these surgeries and countermanded the other rules for all surgeries. So I've done one. I had one surgery that was urgent. I've already done in the last 5 weeks. It's the only one I've done. It needed to be done. Okay, it was an urgent emergent surgery. So, but I just had to do that. I got it attested, certified, had some other doctors look at it to make sure I wasn't making it up. Everyone agreed. There's a whole process. Well, the new recommendations from the state of Oklahoma, I have to read them to you because they just make so little sense that it's really hard to understand. It says elective surgery centers, because there's elective surgery centers, and hospitals must administer COVID-19 tests in partnership with private labs to test all patients prior to surgery. So does that make any sense? So if you have appendicitis and you go to Mercy or Integris or Norman Regional, you have appendicitis, they can't do your surgery until your COVID-19 test comes back, which no one has instant tests anyway. The fastest they can get them on timing is in about 6 hours, and most of the times it's 1.75 days. Or you have an ectopic pregnancy and it's ruptured, you're bleeding to death, but I can't operate on you unless I get a COVID-19 test. So the state just went totally backwards. And then, so that puts all of us, whether you're a facility or a physician, at risk of violating state guidelines. So if I don't do a COVID-19 test for an urgent or emergent surgery, I'm breaking guidelines. That makes no sense. Then they kept on saying that, the state isn't responsible. Then they said, patients should receive a negative COVID-19 test result within 48 hours of the scheduled procedure. So you have to figure out the timing. And that's really helpful since the governor said we could start elective surgeries on Friday, and they put this out at 4 o'clock today. And most of those patients are already pre-opt, and a lot of them haven't had COVID-19 testing if they don't have any symptoms, and they're low-risk patients. So again, just kind of messing with the system. The point is this goes on and on, but it just illustrates how the governor does one thing, the state health department does another, and there's no communication. Did anyone contact any of the hospitals, any of the chief medical officers or anything? And the answer is no. And so our state is a complete fail administratively on an executive level for this whole thing. And the other part of that is they've said, we are not going to supply or do any of the tests. Either you have to partner with a private lab. Remember when the governor had Casey Shrum out there a month ago when he was doing one of his earlier presentations, said, we're going to get to 10,000 lab tests a day. And we're going to do it like that. And it's like, that's how it's going to be. They can't even still do enough for the state a day as it is, like doing 300 to 500 breaks them. And so why doesn't Governor Stitt, and I don't mind that he went fishing with his kids, I think that's great, he should have, but to an extent also this last weekend, I would say, how about doing your job and getting the state testing up to snuff so we can actually care for people? And and get supplies and masks to the facilities that need them, besides the big ones who are doing it mostly on their own, and get some PPE to available for purchase, at least to dentists, so that whole dentistry industry can restart. And because they've been really ignored in all of this, and they've really took it on the chin, and they're in the highest risk group next to ENTs and potentially GI doctors and anesthesiologists for getting a COVID infection from a patient. So how about helping them? But there's no help from the state because they're competing against everyone to get the PPE for the National Guard and for the groups they want. So the thing I want all of us to recognize is COVID's here to stay for the next several years. We can deal with it nutritionally, but one of our greatest obstacles we're dealing with is the government. And you just have to realize the Oklahoma state executive branch has really failed. The health department, I think, has had many failures, but some of what they're doing is in reaction to getting completely blown off by the governor. So they're trying to add some sanity to the recommendations, but the sanity they've tried to add has actually backfired. So we're not getting help there. The federal government's a mess, and we're basically left to our own devices to an extent. And so if you're left to your own devices, you need to do what you can. Take your vitamins. And that's all I have to say tonight. Good night. Oh, we're going to maybe have a special guest tomorrow night from Georgia, live on this part of the talk. Good night.